Hi again, everyone. What we're discussing in these weeks, as I mentioned in the earlier recording, is the market forces and health policy, two major contributors to how we address change and manage the current and ongoing change in healthcare. I wanted to take a brief amount of time to highlight the approach of John Kingdon, who is a researcher in this field, who's done a very good job of presenting this in a way that's easy to understand and apply. And it's not just related to healthcare, it's really generally on all public policies. So when we have our WIMBA next week and we're discussing your group policies, I hope that you will have, by listening to this, you'll be able to talk a bit or to look at the policy you're proposing from this point of view. So let's jump in. The way he describes it is he discusses who participates in health policy, in the development of it. He talks about the streams. There's a number of activities going on simultaneously that are necessary to get a policy done. This is a multi-directional kind of approach. There has to be a clear agenda on, and who sets that agenda, alternatives we'll talk about, and then how those streams interact. Who are the participants? On the national level, it's Congress, it's the executive branch, lobbyists, but then you have others, the journalists who are reporting what's going on, academics who are studying it and analyzing policies and supporting recommendations that go forward. On a local or state level, it would be very similar, except it would be the state government officials. But let's look at participants from another point of view. You have those that are very visible, those that are kind of the face of a cause or the face promoting a particular policy. Those are the ones who generally receive the press and public attention. Could be a high-level official, it could be a media individual, a particular party, an organization, but generally it needs a face on it for something to move through. The point being that there are so many policies that are proposed or just even thought of and considered. They might not even get to the point of being proposed, and very few make it all the way to the end. So this point of view is trying to say, what is it that gets some all the way through and others don't make it? So one is you will see a face on it, the visible participant, and then you'll see the behind the scenes. You won't see them, that's not making sense, but there are behind the scenes players who are the support players, basically. They are the academics, again, who might be doing the research or compiling proposals. You have career bureaucrats, staffers, all the people it takes to put together a policy, to get the language correct, to get the proposed cost projections down, to measure the impact, and to do all of that and also to study alternatives, which is often the challenge in a policy. You may present your way, but others have presented other ways. So part of presenting your point of view is to compare it to alternatives that are proposed. Kingdon also talks about policy entrepreneurs. So if you are generally someone that's proposing a major policy move, generally you're going to have a leader. And he uses the term entrepreneur because much of the work they do is along those lines, where they have to be the one that's up front. They have to be able to bring the attention to the problem. They have to make it either politically important or touch on public opinion and shape it and get it behind the policy. So they have to help define the problem and present it and lobby for it, and they have to be the ones that basically are negotiating and building support. That's kind of the soften up phrase. So let's move into the streams that he sees. He sees three. First, you have to understand and recognize what the problem is. A policy is generally a solution to a problem. We see something that's not working and it needs changing, or there's, say, something new coming in the marketplace that needs some regulation or needs more oversight or some approach like that. So the three streams is, one is recognizing the problem, and you'd think, well, that should be pretty easy, but clarifying it and making it very understandable can be a challenge. From the problem, you have to form and shape the policy. Again, not easy, and there are many alternatives. And as we've seen, say, with policies in healthcare about payment mechanisms alone, you often have unexpected consequences. So policy is really just trying to shape what you think will work and avoid negatives that might result from the very policy that you get implemented. And then, of course, managing the politics of the whole process. So if we look at the problem side, why do some get attention and others not? Well, one, if it's a big issue. If it's got major public attention, it's a disaster. You know, policies passed in the wake of Katrina, or others having personal agendas that they can galvanize a lot of people behind them, or that they're getting a lot of complaints about a certain a current program or policy, and that's what brings it to the attention and brings the problem up. So if you're implementing a policy, you got to get your problems up there because you're fighting for the attention of those that make the decisions. The policy entrepreneur, we kind of talked about that and the role that person plays. So decisions, again, use indicators. A lot of work goes into data and documents and saying and quantifying a problem. And again, the data can be looked at and used in different ways. So a lot of the problem recognition is getting your assessment of the problem and your idea on the numbers or the financial impact to be accepted and seen as truly defining the problem. The politics, well, those probably we all understand by just watching things. The national mood. It took decades for the national mood to get to the point where healthcare reform passed at all. It's been tried since the 50s. And so why didn't it happen sooner? A lot of that is the national mood, the frustration bubbling up so that it really becomes a problem that has to be addressed. It can't be ignored or pushed aside. You have changes in administrations, you have changes in the makeup of Congress or any state government legislature. So again, that shifts things around because it affects the balance of partisan sides or ideologies. And then you have interest groups that might press demands. And again, interest groups come and go, or they have more strength at some points than others. So all of that's happening. Now, when you get to making the decisions, again, I think we all kind of realize that it's done by consensus. You have to build support. You make trade-offs. Hopefully, you don't do too much over-lobbying and kind of have money for votes kind of thing. But you definitely need to work with the officials and coalitions. If you want to go into a senator's office, for example, and promote a particular policy, well, then you want to come in and say, this group's behind me, this group supports it. So building that consensus is a trading, bargaining kind of approach. And generally the mood and, of course, the elected officials, hopefully, tend to be more important than the interest groups. But I also want to point out that interest groups, or if you want to say lobbyists, play a role of educating the legislators. They can't know everything about every issue, so you can see the value of having experts come in. The challenge, I think, for the elected official is to have enough knowledge to understand and select among all the positions put in front of them. The agenda setting, these are the list of subjects that are at the top of the list at any given time, and you want to be at the top of the agenda. You basically definitely want to be on the agenda. Alternatives to an issue, that's probably a logical step. If something's a controversial issue, it might have many people proposing ways to address it. And so first step is kind of the alternatives come out, and probably it gets narrowed down, or through bargaining and others, they get down to one or two that are going to be supported by groups, and that leaves the other alternatives behind. So we're in this policy stream, and so the hidden participants are doing a lot of the study of analyzing one alternative over another. They're floating ideas out there, anything to just get their point of view some attention. And that might mean you have to get out there and have an idea, but just by talking with people, you understand what their objections might be. You go back, you try to retool to address their objections. You might reshape your ideas, and so on. So it's kind of a give and take. And then you come down to a smaller number of alternatives, and they call it natural selection. You know, the strongest, it's not necessarily survival of the strongest, maybe it is survival of the strongest, as opposed to survival of the most workable, but there are only certain ones that get to the top. Then generally, if you're assessing policy alternatives, you're going to look or try to make your own assessment of, is it doable? And we usually make our choices based on our values, or say the values of our constituents. And then we try to anticipate what will happen down the road. Well, it's an excellent idea, but I won't support it because it's going to add to the budget deficit, and I'm not comfortable with that. So again, you make these, the decision makers basically make those assessments. Softening up is really building support. They push for consideration. Most policies take years to work their way through the system. It's not a fast process, unless maybe it's a crisis situation or there's real public demand. But also, even in those instances, the public demand has been pent up. The reason it come and become such an issue after a very long time of dissatisfaction having to get to a critical point. So it's also what we find is the nature to try sometimes to fix a current policy, then bring in a whole new policy. For example, in our healthcare system, we're adding fixes to our existing system, even though we know our system is greatly flawed, but there's no way we're going to just stop it and start from scratch. It's just never going to happen. Let's talk about what these streams are. So the three streams are the problems, the proposals, and the political events. And each of them have lives of their own. And think of them as moving along at the same time, and they overlap at points where need be. So someone's out there developing a problem. There are always policy proposals being floated and argued and presented and trying to build support. And then the political events can happen. So you might have a problem that is coasting along for years, and whoever's promoting it just can't get anyone's attention. And then suddenly something happens in the political arena that brings it to the fore, and so the streams cross each other or join up for a time being. A policy, again, might be out there floating around, and then another problem is raised, or a politician is newly elected and supports a particular policy, and again, now those two converge, and it brings it higher up onto the agenda. So the odds of your being high on the agenda and getting a policy passed is the more all of these streams join. If you've got the problem clearly defined and delineated, if your policy is drafted and sound and you've built support, and then you have political backing, well then you can see where that would really increase your opportunity and your odds. Partial couplings help, but if you don't have some of these coupling of streams, you're in a very difficult position to make your policy move forward. Here's one trying to visualize it. It's probably not the best, but you see the three streams kind of moving along together, and you've got time along the bottom. So all of this is going over what we know to be a significant amount of time. But what Kingdon then says, when all of these come together, that's your window of opportunity. And he says, if you are in this process and you're trying to get a policy passed, one of the main things that you have to do is recognize when that window of opportunity is there and act on it. Many times you might be, if you're not knowledgeable, say you don't have someone that's really skilled in this, you don't see that this is your moment to try to get it all pulled together. So he does a lot of talk about the window of opportunity, and that's where these streams converge. So that window opens when it's your chance to be advocating. That means it's got more public attention, you've got support, and you are able to move. The window doesn't stay open very long. And the entrepreneur is the knowledgeable person or group that knows how to hopefully make the window open and then take advantage of it to move things along. And as it says at the end here, it's just persistence. This is a very, very long process. And here again, just another way of visualizing that they're not streams, but that area of overlap is your window of opportunity. So that's it, and I hope that when we are in WIMBA next week, we can apply some of this to the policy proposal.